Hello all, and welcome to the Diversity in Medicine webinar series. My name is Jenny Tassler. I am the Vice President for Government Relations and Strategic Affairs here at the Associated Medical Schools of New York. And tonight our webinar is being presented in conjunction with Memorial Sloan Kettering Cancer Center, and we are thrilled to welcome them. I'm also pleased to introduce everybody to Dr. Patricia Mae Santos, who is a rising fifth-year resident in Radiation Oncology at Memorial Sloan Kettering. She can go ahead and get started. She's going to be giving you an overview of her career path, how she found her way to radiation oncology at Memorial Sloan Kettering, and a little bit of background about her research and the experience she had as a student. So, Dr. Santos, the floor is yours.
Okay, awesome. Thank you so much. I'm very happy to be here. Like Jenny mentioned, I'm going to be going over my experiences at MSK, both as a medical student and as a resident now. But let me see if I could okay. So just to start, just who am I? I'm currently, as Jenny mentioned, a rising fifth-year resident at Memorial Sloan Kettering Cancer Center in the Department of Radiation Oncology, doing residency here and entering my final year. But I'm also an immigrant. I'm a daughter of immigrants, and I've been a lifelong New Yorker for as long as I could remember. So the whole point of this talk really is just to sort of explain how I kind of got from point A to point B. What I'll tell you is that, even though most people will think that, the path from point A to point B is very linear, as things kind of wind and change and twist and turn. And, that's okay as you're starting to kind of go through your medical school journey and on your path to medicine. It's okay to sort of be unsure about certain things, take risks, take chances, and kind of find your path that way. So I'll kind of go from there. So just to begin, so I was actually born in Manila. As I mentioned, I am an immigrant. I was born there in April of 1991, and then immigrated to the United States when I was 2 years old, and we moved to Brooklyn, New York. I lived in a neighborhood known as East Flatbush, Brooklyn, which some of you may be familiar with. It is considered a low-income, low-resourced neighborhood in the heart of Brooklyn by the Centers for Medicaid and Medicare Services. I lived right here and 426 Linden Boulevard and spent most of my childhood there. Just a bit of background about the area. So East Flatbush, Brooklyn is predominantly Black neighborhood. It's sort of considered the Little Caribbean, probably one of the last places in Brooklyn to be gentrified. So, slowly but surely it'll happen. But, that when I was growing up, that was the makeup. And most of the individuals there, at least 1 and 2, are born outside of the US. So there's a very big immigrant population there. But a lot of them are English proficient and working professionals as well. My parents immigrated to the United States as part of the wave of Filipino nurses. So my mom was a nurse who came in the late 1990s and was sort of part of that wave of immigration, and has worked in this underserved neighborhood her entire life, and my father has as well. So, very, very strong ties to New York and to Brooklyn in particular. Every day, when I would go to school, I would take the 2 train or 5 train at Winthrop Street, and I would go to school over at Brooklyn Tech, which is where I went to high school. There, I sort of kind of discovered my love for science, but also my love for history. I really wasn't sure which way I was going to go. Parents thought immediately I would go into medicine, but I wasn't so sure. Because of that, I decided to not opt into, one of those direct to MD schools, the BA/MD programs. And I decided to go to school in a city called Providence in Rhode Island. And I went to school over at Brown University, where I did kind of do half and half of what I wanted. I took my time to study science. I studied neuroscience in particular. I just fell in love with the nervous system and the way it just really impacts who we are, how we think, what we do. And I was just so enamored with that science, and I really delved into that while I was there. But I also really honed in my interests in writing and reading and literature, and in particular history. So while I was there, I was able to kind of cultivate these two aspects of my interests, both the science and the arts. And, I really loved and enjoyed my experiences there. And I think that that kind of blend of, empiricism and humanism, I think was what ultimately drove me to pursue medicine. Um, After a quick detour back in New York for 2 years working in a lab at Mount Sinai, I ultimately decided to finally go to medical school, this time going to Pennsylvania. I went to the University of Pennsylvania Perelman School of Medicine. And here's a picture from my white coat ceremony. I kind of wanted to section this off and kind of think about this sort of different decision points that I had during medical school and residency. And I think one of the biggest decisions that weighs on us in the medical specialty when we're first entering is choosing your specialty. What am I going to be when I grow up? What I'll tell you is that, some of it is active. Some of it you're kind of actively pursuing your interests. I was a neuroscience major, so I thought by default I was going to be a neurologist or a neurosurgeon. And to this day, I still find the brain exceedingly fascinating. I love neuroanatomy. But in many ways, I didn't actually choose my specialty. And I know this sounds so corny, but it really did choose me. And I think it's because of the people that I met along the way that really made me feel like radiation oncology, which is what I'm in now, is the specialty for me. One of those people is my longtime mentor, Dr. Neha Vapiwala, who is a professor of radiation oncology over at at the University of Pennsylvania. And she's also the associate dean of admissions at the medical school there as well. Before I go on, I did meet her by chance. So again, this is the idea of sometimes your specialty and your people finding you. She was assigned to me actually as my first year mentor on my advisory team. So it was random, completely by chance. And I was immediately struck, by, her warmth, her very generous spirit. She was obviously very busy, but somehow she always made the time to, listen to my concerns. And I very quickly built a rapport with her. And I think for me, it kind of came down to understanding and really knowing what I wanted in a mentor. And we could talk more about it later. But for me, I really wanted someone who could sort of be my champion and, talk me up when needed, but also allow me to be vulnerable in moments of doubt and really lift me up in those moments as well. So Neha has been that person for me for years. She was that person for me during residency, but she was also a research mentor for me. So in addition to, just mentoring me through the process of being a medical student and all the ups and downs that come with that, she actually was a research mentor for me. So she is, as I mentioned, a radiation oncologist by training. She was actually the former program director at Penn before becoming the vice chair of education and the dean for admissions at the medical school. Um, you know, as part of her clinical role, she treated prostate cancer and other genitourinary malignancies. And we did a study together, and this was one of my first and largest retrospective studies that I had done with her. And really in general. So this was my first experience doing that. So this was a study looking at proton beam therapy versus intensity modulated radiotherapy, neither of which are terms you need to know. But really it was a quick foray into really understanding what radiation oncology was about and understanding the different technologies, the pros, the cons, the risks and benefits. And I did that all under the mentorship of Neha. And this was the first of many future collaborations that we did together. So I just wanted to sort of highlight that here. Now, during medical school, I also found opportunities to find mentorship outside of my home institution. One of those opportunities was at MSK. I wanted to be back in New York, honestly, the summer between my first and second year of medical school, because it meant a lot to me to be home with my family and friends. And MSK luckily offered this wonderful program known as the Medical Student Summer Research Fellowship, which is still ongoing. As a result of this program, I did get a first author paper on the American Journal of Neuroradiology, I think. And this is a figure from that paper. It's been a while, but the paper focused on looking at novel imaging techniques. So specifically dynamic contrast enhanced MRI and perfusion weighted imaging. Again, don't need to know this, but it was a novel imaging technique that allowed us to monitor tumor progression after radiation treatment. As part of that study, I actually met another mentor, pictured here, Dr. Josh Yamada. He is a radiation oncologist and attending at Memorial Sloan Kettering, and he is a world-renowned expert in spine radiotherapy. I had the pleasure of meeting him then when I was a medical student and was on a paper with him. And ever since then, he's just sort of been this, again, warm, gentle figure who was always willing to answer questions and always willing to help however he could. He ended up writing me a letter of recommendation as a result of this program, and I think was a very big part of the reason why I ended up in the residency program at MSK. And I will say that after having rotated with him now as a resident, I have to say rotating with your mentor, your research mentor in a clinical setting is really nerve-wracking because you don't want to disappoint, but it was just as great as I thought it would be. And even though his rotation is notoriously very busy, and we could talk about that later, I had the most fun that I ever had on rotation just because he was such a great mentor, and his team, shout out to Emily and Kathy. I don't know if they'll ever see this, but they were just the most fantastic nurse and PA that I could have ever worked with. So a lot of really great things came out of this program, including lifelong mentorships and future friendships that I never even realized would happen. As a second opportunity during medical school, I wanted to seek more mentorship, having had a very positive experience the first time that I was at Sloan Kettering. I wanted to pursue a medical student elective or an away rotation there as well. At that point, I had already decided, because of my interactions with Dr. Vapiwala and Dr. Yamada, Neha, and Josh, that radiation oncology was a specialty that I was highly interested in. But from a clinical perspective too, it meant a lot to me as well. I had personal experiences with not nuclear family members, but very close loved ones losing their parents to cancer. So my mom, brought my grandfather to the United States for cancer treatment. And we watched him go through the process of chemo, radiation, and surgery, including a laryngectomy and not in that order, but he did go through all three modalities for the treatment of metastatic laryngeal cancer. That was a very profound experience for me, and I think really left a mark on the ways in which, cancer can devastate a family, and the ways that which we might be able to intervene to really help loved ones through a really tough time. After that experience, I also had a partner whose father died of acute myeloid leukemia after a bone marrow transplant failed to engraft. And that experience was also extremely affecting. And I think for those reasons, I felt very drawn to oncology. So just wanted to, put that out there. In addition to finding really great mentorship, I also took a look inward and really thought about who are the patients that I want to take care of, what kind of doctor do I want to be? And radiation oncology offered me the opportunity to practice with a patient population that I felt very personally and deeply connected to, but also work with and model my craft after mentors who I aspired to be like Dr. Vapiwala, like Dr. Yamada, but also like these four individuals here who I met in the away rotation at MSK. So in the top left corner is, I don't know if you could see my mouse, but this is Dr. Michael Zalewski, who is a prostate radiation oncologist and a brachytherapy expert. He was one of the first people, he was the first person I rotated with at MSK and was the former associate program director there as well, and is currently the chief of the genitourinary service. He is a profound champion for students and trainees. And, it was a really remarkable experience getting to work with him. And he still to this day loves working with medical students, loves working with trainees. And he was a real mentor right off the bat, the real type of person who would really go to bat for you. And again, it's another example of how people is just sort of, you kind of find your people when you're picking a specialty. In the top right corner is Dr. Catherine Beal. She's no longer at MSK. She's now across the street at Cornell, but she was the chief of the CNS service here and also a wonderful mentor to me as well. We actually did a presentation together at the end of the rotation, which is structured over the course of 4 weeks across 4 disease sites, so prostate, CNS, and then I'll talk about my experiences with Dr. Wolden in peds and Dr. Wu in lung in a bit. And also there's a final presentation, which I did do with Dr. Beal, reviewing a case of a abscopal effect, which is when radiation treatment to single part of the body may actually cause a tumor response in an untreated area away from the body. It's a very interesting phenomenon, so it was good to review that in the final presentation. And again, I also worked with a renowned pediatrics expert and radiation oncologist, Dr. Suzanne Wolden, who is also a phenomenal teacher and is, real joy to work with, both as a medical student, as a resident, and of course, our former program director and current lung GI expert, Dr. Abe Wu. Again, all 4 fantastic individuals, 3 of the 4 still practicing at MSK and ready and willing to accept medical students. So if it's something that you are interested in, they're currently accepting applications now. I know that they've already picked a few, more than a few rotators, so I don't know if they're running out of spots. But if you are interested in this specialty and want to learn more, I'm more happy to talk about this further. Now, I wanted to kind of broach the question of whether or not you should do an away. And for me, doing an away rotation was something that was expected in radiation oncology at the time. But my story was a little bit different because I really wanted geographically to be close to New York City. I had very strong family ties, as I mentioned. And for me, I wanted to do everything that I could to not only maximize my clinical experiences and my mentoring relationships with individuals at Sloan Kettering, where I had hoped to do residency, but I also, really wanted to get a chance to, test out the institution, kind of really see what it would be like to be a member of the department, to be integrated. Do I fit in with the residents? Does it feel like a place that I can work? These are things that you should be thinking about when doing an away rotation. So number 1 would be, I'd say, is it really required? Will it help or hurt for your given specialty? In my case, in radiation oncology, it was sort of an unspoken requirement that you do at least 1 away, but there was no expectation that you did more than 1. The second was for strategy. Will the away rotation give me some kind of strategic benefit in the medical school application process? For me, I wanted to leverage and kind of double down that I was very interested in Sloan Kettering by doing a full away rotation in addition to a research elective. But I also wanted to show my geographic interest. So in addition to doing away rotation at Sloan Kettering, in addition to my home institution at Penn, I actually also did away rotations at UCSF, as well as the Harvard program. UCSF was a strategy choice. At the time, my parents were considering moving to Hawaii, where we have a home, and to be closer to the Philippines because they're approaching retirement. And for me, it's very important to be close to family. And as a person who lived in the Northeast her whole life for training and for childhood and adolescence, I didn't have strong ties to the West Coast. And I wanted to, number one, test out, what it would be like to live on the West Coast, but also to demonstrate to programs that I would be willing to make a commitment to really engage in a department and to make the move across country. My experience at UCSF, and I know we're not promoting UCSF right now, this is focused on MSK, but I have to say that my experiences at both UCSF and at Harvard were both incredible. I also found really wonderful mentorship at both institutions. Happy to talk more, but I don't think, one thing I want to really make clear though, is it's not quantity over quality. In all of these instances, they were all very thoughtful, and they were all very strategic. And honestly, doing 3 OAs was not at all my intention. And for me, it was more about the opportunity presenting itself. The third rotation at Harvard was actually as a result of a financial opportunity where they actually offered to pay for the rotation, which some institutions do provide funding. I'm not sure if MSK does. We can talk more, but some institutions do provide funding because doing away electives are extremely expensive endeavor, especially if you're living in a city that you are not from. You have to think about housing, you have to think about cost of transportation and living expenses, especially since you are a medical student and presumably you are not making income apart from maybe loans or family support, unless you are an amazing medical student and somehow finding time for a part-time job. I know that I didn't, but because I had the financial support to do it, and I had already submitted my ERAS at that point, I thought, why not? It might be nice to do a rotation to really see what it was like, because I was also strongly considering the Harvard program. So in the end, I think that, the main takeaways here about whether or not you should do an OA is, number one, will it help or hurt? And it's sometimes very specific to a specialty. Number two, is there a strategic benefit to you doing the rotation, for example, showing geographic or institutional specific interest? Number three, are there any financial constraints to consider? Are you able to afford doing an OA rotation if the opportunity is made available to you? So if you guys have questions, I'm happy to answer now, or we can keep moving on, and we can I can answer some more later on. So I think I'll just keep moving on, but if anyone has any questions, we could talk more about it in a bit. So moving on to match day. So I did match to my number one. I matched to MSK for both transitional year internship under the direction of Dr. Corey Salvit. This is a picture of all of us during the pandemic when I was an intern. This was at the end of 2020. So this was just when the pandemic was happening. And it was a wild time to be an intern, and especially an intern in New York City, where the pandemic was at its peak. I don't think any of us could have gone through it without each other. All of these smiling faces are as a result of really strong friendships that I built throughout my intern year. And actually 3 of my co-interns actually became my future co-residents. So directly after finishing my intern year at MSK, I went on to do my advanced residency in radiation oncology here. And pictured here is Dave Filling, Bill Diplis, and Deb Smith. The 3 of them I did my intern year with. And then we had wonderful additions, Reed Sarkar and Jen Ma, who did their intern years elsewhere. And this is just the 6 of us on a rooftop in New York City on my birthday. So there is a benefit to getting to do residency in New York. I will say that, doing residency in New York, it comes with a set of challenges because New York is a very big city, so you have a lot of people that you have to take care of, and you find that you will treat individuals from all walks of life, which is incredibly important for your growth as a clinician. I think it's also part of the reason why the volume is so high. So it's incredibly clinically busy, but I think that, you know, everyone who kind of comes here is of a very sort of like work hard, play hard mindset. There's lots of programmatic support. There's lots of support between residents as well. We're obviously very fond of each other, as you could tell from this photo, and I have plenty more to share. But I think that when you're choosing programs and, you know, making your rank list, I think the number one for me, and some people may not agree, but for me, I think geography and location is absolutely number one. And I think the reason why people don't want to say that is because you want to pick the place for the program and for the institution. And that is incredibly important as well. And I would say that's definitely number two. But location matters because you want to be able to go to train at an institution where you will be happy. And part of being happy during the difficult time of, you know, being an intern or being a resident is being close to, for me anyway, loved ones, being close to family and friends. For others, it might be being close to nature. You know, being in the city might not be your jam, right? After you've been here for 4 years, it might not be your thing, but you also may be profoundly connected to New York, being medical students from New York. So I highly encourage you to think about a geographic location when it comes to deciding your rank list, and really thinking about it as one of the top things on your list. After that, of course, and it's a very close second, is the program itself. You know, does the program culture fit what I want and how I want to learn? It's important to think about whether or not you are a person who learns by doing versus a person who really learns by formal didactics and educational talks, case conferences. And, you know, all programs will have elements of both, but I think the ratios will be different depending on the places that you go. You'll find that you will get a lot of autonomy, a lot of hands-on experiences in big cities, often where there's like lots of volume. But you'll also, in places where there's not as much volume and there's not as much cases, you may get more didactic and educational opportunities, and it may be a little bit quieter. In the end, I think you can get excellent training, but for me, I think it was extremely important to be able to see a case and know that I had seen it before, and not be frazzled walking out of residency thinking that I am walking into the wild. And of course, it's always going to be hard, no matter what. It's always going to be scary to be an attending for the first time, no matter where you train. But MSK does an incredibly great job of making you a very efficient, a very thoughtful, and very clinically oriented and intuitive physician, at least from the graduates that I've had. And I think everyone who's graduated from MSK from the programs that I've been to has gone on to have very successful careers, whether it's in dermatology, radiology, anesthesia, et cetera, or if they went on to radiation oncology like myself. I think that everyone had profoundly excellent clinical training, and I look forward to being one of the graduates in the coming year. So just wanted to take a note to kind of touch base on what I'm working now, and what things I'm pursuing now while in residency. This is a picture of one of my mentors, Erin Gillespie, who also was a former MSK attending and recently moved to an associate professor position over at the University of Washington. But she and I did a number of studies together looking at hypofractionation, which is a term that refers to shorter courses of radiation therapy. Long story short, historically, the treatment of certain cancers like prostate cancer and breast cancer involved treatment over the course of 5, 6, or 7 or 8 weeks in the case of prostate cancer. So these are considered conventionally fractionated regimens or long course schemes. But there is data now to suggest that shorter regimens or hypofractionated regimens for breast cancer, prostate cancer, and also for bone metastases actually confers equivalent or non-inferior clinical benefit without compromising time and reducing overall patient burden. And despite these recommendations being made through multiple national guidelines, uptake of these practices has been relatively slow in the United States. As a result of that, we together did a number of studies looking at guideline concordant radiation and the use of short course radiation among vulnerable populations. I had a special interest in looking at the use of guideline concordant radiation among our most vulnerable cancer patients, which are patients who have advanced or metastatic cancer who are at the end of life. And this is a study that was published in JAMA Health Forum, and we have a few other studies published as well in the Journal of Clinical Oncology, Oncology Practice, and as well as the Red Journal, looking at different aspects of this question. Erin is now doing work in implementation science, trying to take evidence-based practice and putting it into the real world. And her mentorship has been really effective for, helping me to think about how I could incorporate that skill set into my own research training. Separately, I have also been working with Dr. Fumiko Chino, who is still here at MSK. She is a assistant attending in the Department of Radiation Oncology, whose work really focuses on health equity and health disparities, which has become a real passion of mine. And this is just to sort of go back to that idea of the winding road. I was a person who really started as someone who was a basic lab person. I worked in a basic lab in undergrad, and I worked in one for 2 years before going to medical school. So I had a very science-oriented mind. But what I found was that being in the lab felt too far removed from where I wanted to be, and that was impacting patients and impacting patient care. And even along that spectrum, it wasn't even enough for me to do one-on-one interactions with patients and to help them one-on-one. While I found those interactions extremely, important, and I still do, I wanted to do more. I wanted to see what we could do from a policy perspective to impact communities more broadly. And that's sort of what led me to work with Erin initially, and now Fumiko, or Dr. Chino, and gave me the opportunity to really work on research that was important to me and to my own identity and positionality as an Asian American woman, as an immigrant, as a person of color. As a result of that, I published this passion project, this paper in the New England Journal of Medicine. It's a perspectives piece talking about healthcare reform and equity for undocumented immigrants. Specifically, we talk about the emergency Medicaid program, and we talk about it as an insufficient solution to gaps in insurance coverage among undocumented immigrants who are not covered and not qualified for public forms of health insurance under the Affordable Care Act. We talk about this issue there, and we talk about state level variation across the United States and its impact on immigrant health, not only in the context of emergencies, which is where emergency Medicaid is often applied, but also in the context of chronic illnesses and specifically cancer. So this work was published in the New England Journal this past year. And it actually has now led to a couple of awards from the Conquer Cancer Foundation. I just been awarded a Young Investigator Award, and the formal announcement will be announced later this month. And also was awarded a merit award for an abstract that we submitted to this year's ASCO annual meeting, looking at insurance barriers and social determinants of health and their impact on the affordability of care among immigrant populations with cancer. In the upcoming year, I look forward to using the funding from the YIA and other funding sources, fingers crossed, to continue doing work in populations that are really meaningful to me and really speak to, not only my research interests, but really fundamentally to who I am as a person and, how I identify. So, kind of wanted to discuss how to find and keep a mentor, but also really wanted to touch on those points about really looking for research that speaks to who you are and asking questions along the way. I think finding mentorship is tough. I've definitely, have tried and failed, some mentoring relationships sometimes, and sometimes it's neither the fault of you nor the individual mentor. Sometimes it's just not the right fit. And I think that expecting every mentoring relationship to be perfect is unrealistic. I think you find what works best for you by engaging with different people. And there is no one size fits all, and no one individual can meet all of your mentoring needs. That's why people talk about the concept of mentoring teams, where you're able to get different forms of advice and different skill sets and different experiences and different forms and avenues of support from different individuals in your mentorship team. And I think that the only way that you'd be able to do that is by actually putting yourself out there, sending that cold email, looking for the connection, that person who knows somebody to connect you and to find that individual who will be your champion. And sometimes it's a very senior person, like your Nehas or your Zlevskis or your Yamadas of the world. But sometimes it's a junior faculty member or a new attending, or sometimes it's a resident, and sometimes it's your peer. It's your fourth year medical student when you're a first year, just guiding you and sort of helping you to kind of navigate those day-to-day issues when it comes to going through medical school, and also making these really important decisions when it comes to residency training and beyond. And then talking about research, again, I think that the main point of advice that I want to say here, and that what I found from my own experiences throughout my journey at MSK, has really been to kind of stay true to who you are, to listen to your interests and allow them to evolve over time. I think if you look at the research that I've done, 5 years ago, 10 years ago versus now, you'll see the evolution from a basic scientist to a policy researcher. And it's kind of wild and incredible that happens, but I think that it's really wonderful to kind of see. I embrace it fully, and I hope that you do too. And I think that whenever you're, very true to those interests and you listen to the ways in which they are dynamic and they evolve over time, I think that you'll find that you will ultimately, if academic medicine is for you and research is for you, you'll find the topic and the things that you are most passionate about. And on days when you wake up and you don't really want to write that grant or write that manuscript or do the work, it'll be important enough that you'll be willing to do that, not only for the research itself, but also for the impact it can have on patients, whether it's from a science perspective or from a policy perspective. So that's like really it. That's sort of the whole crux of my journey here at MSK, which is still ongoing. I have 1 more year left. I know it's a pretty quick presentation, but I wanted to leave it open for questions and discussion. So thanks.
Thank you so much, Dr. Santos. That was an incredible presentation, very comprehensive. As we mentioned, we have lots of time for questions, and then I believe the team from MSK has some information to share as well. So if you have a question, if you're not in a position to turn off your mute and ask verbally, feel free to drop it in the chat. Otherwise, you can go ahead and raise your hand and we can have you unmute and ask your question. While we let people think a little bit and type, I guess I would ask you, Dr. Santos, what are some of your future plans as you enter your final year of residency? What do you see for yourself beyond residency?
Yeah, that's a great question. And it's one that I've been thinking about, obviously a lot now that I'm entering my 5th year. I initially saw myself and probably will still go into an academic role and continue to pursue my interest in health policy. I feel like there's a lot of momentum right now in the work that I'm doing in immigrant populations and other marginalized populations with cancer. And I really want to continue to build on that momentum and build on that work. I think that this past year, which is an actually interesting point about radiation oncology, is that most programs offer you a full year of research that's embedded within the structure of the program itself. And I think that I took this year and I really ran away with it. And it was really an opportunity to really engage with those interests even deeper and really become more confident in my skill set as a researcher and take more opportunities to learn and build that skill set. When I graduate from residency, my hope is that whatever, position that I take, I will still have plenty of opportunities to continue to build that skill set as I go along and become a better researcher, a better physician moving forward. I see myself in an academic role, most likely doing this kind of work, hopefully, generating data someday that may actually impact legislation and policy that might offer more broad access to insurance and healthcare in general for marginalized populations. So that is the long-term goal. The way that I get there may be different. It might be, through a faculty role, like a formal faculty or attending role at an academic institution. There are also fellowship programs, and postdoctoral fellowships that can be done as well. One program I am considering is the National Clinician Scholars Program, which, if any of you are interested, it's a program that you do after you've finished your specialty training, usually at the end of fellowship or residency training in my case, because we don't really do fellowships in radiation oncology, except for, the rare exceptions. And it is a 2-year, effectively, instructor / postdoctoral fellowship that is done at one of 6 different sites in the United States, UCSF, UCLA, Michigan, Penn, Yale, and Duke. And it's an opportunity to really engage in more health advocacy, health policy work. I think the fundamental idea here is that they want their fellows to really work on putting their research into practice and really affecting change, which is something that I think is incredible and is something that is not well taught unless you seek it out. So it's something that I'm considering doing as well as an alternative. So we'll see. I think everything is kind of up in the air right now, but I think that's the fun part about it. So
somebody did ask quickly, what is that opportunity called again? It's the National Clinician Scholars?
Yeah, National Clinician Scholars Program.
Great. And there was another question in the chat. Do you have a case from any of your away rotations that sticks out in your memory?
Wow, it's been a long time since I away rotations. At this point, it's almost been 5 years. Yeah, it's probably been 5 years. I have to say that actually one of the most interesting consults that I had was when I was in California rotating at UCSF, actually. And it was a case of a woman who had metastatic breast cancer, who came in for a consultation for treatment to a spine metastasis that was causing her pain. And actually, from the very beginning, outright did not want the radiation, nor did she even want the referral. And she actually wanted to pursue alternative medicine and integrative medicine options only, which this is not to, say anything bad about patients who pursue that. Actually, we have a wonderful integrative medicine department here at MSK who works very closely with the radiation oncology department and the medical oncology department to help with toxicity from treatment and symptom management. And I think these could be very powerful adjuncts to recovering from intensive cancer therapy. But I think in this instance, it was really interesting, just the dynamic of, watching and attending really field a patient who was very resistant to the idea of radiation to begin with. And, learning how to really maneuver that interpersonal skill set in such a way where you feel that you really are informing the patient of their options, but also respecting their wish to not pursue your recommended treatment, which is always really hard, right? Because you come with all this training, you come prepared with all this knowledge, and ultimately, I think we've shifted a lot towards patient autonomy and for good reason. But I think it really is illustrative of the shared decision-making process, which allows both the physician and the patient to kind of come to a decision together. In this case, I wouldn't say that this was something that was shared by the attending, but this was a very interesting challenge that you find actually does happen more often than you think in medicine in general and also in oncology. So I thought it was a very interesting case.
Great. So there's another question in the chat. Thank you for your time. Great presentation, Dr. Santos. My name is Ishtam, and I am currently a senior at CUNY Brooklyn College, and I'm applying to medical school. I would like to know, what does failure mean to you, and how do you overcome failure in your medical journey?
That's a great question, and it's a very big question. I think, failure is something that I think it's not easy to swallow. It happens pretty often. I will say that I've definitely, quote unquote, failed more times than I've succeeded, I'd say. I think it's a numbers game, right? You knock on enough doors and all you really need is one to open. That's what my dad used to say to me. I think that when it comes to applying to medical school, a lot of it is a numbers game. Yes, we're trying to do pass fail on step one, but there is now step two, right? It's still a number. There's GPAs, there's number of publications, there's all these extracurriculars. There's always going to be the statistics of who you are on paper versus who you are in person, and also what you bring to the table versus what a medical school is looking for. And I think in that setting, I think it's important to really, hold true to knowing what you offer, and ultimately realizing that if the opportunity did not come your way, there is always another opportunity out there. I am of the belief that there is no limited success in the sense that if my colleague is successful at doing something that I'm not, that doesn't mean that I am not going to be successful at something else, or that we can't both be successful. I think that really it's more about not giving up, of course, but also making sure that you are applying to enough opportunities within financial reason. I know that applying to medical school is incredibly expensive and a huge financial burden. I've been there with the primaries and secondaries, and really making sure that you don't leave any stone unturned. You find every opportunity, because all you really need is one person to say yes. And if you're having any issues or trouble finding that opportunity, finding the right school, selecting a school, or putting your applications together, I think you'd be really surprised to find that most people are willing to help, even if they've never met you before, especially in medicine, because it's a very pay it forward type of specialty. It's a very pay it forward type of field. None of us got here on our own. We all stand on the shoulders of people who mentor us along the way. I can't say that I ever thought that I would achieve the things that I have at this point. And I think there's still a long way to go. And there's still opportunity to grow. But I'm very grateful for the things that I have achieved up to this point. And I will say that if you are experiencing failure, don't lose hope. I think if anything, it builds grit, it builds resilience, and it makes you more savvy, in the long run. So, yeah.
Excellent. I see a hand raised. Giovanni, if you could unmute yourself and ask your question, you can go ahead.
Sure. Thank you. Thank you, Dr. Santos, for that great presentation. It was very informative. You gave us a glimpse of what goes on in MSK. I'm a pre-med student. I applied to medical school. I'm working as a phlebotomist in New York. One question that I would like to ask you is, now with the advent of technology and like ChatGPT, how do you think AI can potentially transform the field of oncology, in particular, rectifying health disparities? Do you see like any challenges or limitations to integrating that into the clinical practice? And how do you think that could be addressed?
That's an amazing question. I feel like I've been talking about machine learning and AI with people a lot lately because I think it's just been on the forefront of everyone's mind. So really great and interesting question. I think that when you think about AI and machine learning, and I know that there's that letter out there with all of those experts who know a lot more than me, who are very afraid of the potential harms that it can cause. I think it's fundamentally about thinking of AI and machine learning as a tool, right? A tool like any other tool. It can be used to either mitigate disparities, or if left unchecked, or if applied in the incorrect way without really addressing our own personal biases, they can build upon them and then they can exacerbate them. So for example, there's this example of using machine learning algorithms in order to identify melanoma. So to basically look at skin lesions and to see whether or not they fit the characteristics of a melanomatous lesion, which you'll learn in medical school, kind of follows that ABCDE acronym, asymmetry, borders, color, diameter, and evolution over time. So these 5 things, it kind of looks and monitors for those qualities, among others, to determine if this is a potentially cancerous lesion. Scary thought that it could replace that the role of a pathologist. But the important thing to note here was that this machine learning algorithm, when it initially was developed using scans from individuals and images from individuals who were fair-skinned and who were light in skin color. So these algorithms actually were unable to detect melanomatous lesions in people who had darker skin tones. So, if that's the case, then if left unchecked, and if we don't address these biases that we ultimately integrate into these AI-based and machine learning systems, you ultimately can perpetuate, if not worsen, the disparities, because now you're using a system and relying on systems that fail to detect and underdiagnose cancers in populations where they are more than present. And I mean, even now, we often fail to detect skin cancers in people of color, people with darker skin, African-American populations, Afro-Latinos, et cetera. So I think that it's really important to kind of think about it from that perspective, that it's kind of like garbage in, garbage out. It can, if you are very thoughtful with the information that it's using in order to build and kind of remove those biases away from that info, then it could be a potentially powerful tool for mitigating disparities, right? And a potentially powerful tool for, bringing access to care for communities that are unable to access care currently, either because they're unable to get a visit at the doctor's office. Perhaps machine learning or ChatGPT and other mechanisms can, shorten those wait times. Mental health care is a huge crisis in the United States right now, and the lack of mental health care providers is, a huge issue, not only in medicine, but also among our cancer patients who suffer, depressive symptoms and symptoms of anxiety while undergoing treatment. the idea that AI or machine learning and these chat GPT bots can be advanced enough that they can diagnose symptoms of depression, or they could even do baseline talk therapy before making important referrals to medical providers or expedited referrals, is a pretty profound and important thought. So I do believe that there is a lot of potential for good here, but I think it's really important to sort of check our own biases, because ultimately we're the ones creating the programming. So it will be subject to those as well if we're not careful.
Thank you. Okay, we have one last question in the chat. Thank you for the great presentation. Do you have advice on networking as a medical student at large events such as ASCO?
Oof, yeah, that's really hard. It's really hard. I mean, when I was a medical student, I was extraordinarily overwhelmed at ASCO. I presented. There is, if you guys are interested, usually medical schools are allowed to have one cancer interest group that is funded and receives funding support from ASCO, and individuals who are from an interest group that is one of these CIGs or cancer interest groups that is funded by ASCO can actually present their work and their abstracts at the annual meeting at an oral presentation in your own oral abstract session. And it's actually pretty well attended, which is crazy because getting an oral presentation at ASCO is kind of incredible for anyone, let alone a medical student, but they offer this special place an opportunity for medical students and trainees to do that. So definitely look into that if you're interested. And in terms of actually navigating the conference, I think it's really important to, if your mentor is there, make sure that you check in with them ahead of time. Make sure that you get on their schedule, because ASCO is an incredibly busy weekend for the higher you go in your career. So, the more senior you are, the more events, cocktail hours, talks, panels, lunches, dinners you have to attend. So if you are going to go to ASCO, I would highly suggest making plans with your mentor right now, and also potentially asking them if there are individuals that they can connect you with when you're there. So when you make plans to meet with them somewhere and ask them about networking opportunities, you could use these moments as opportunities for your mentor to make a connection with someone new, someone that you've been wanting to meet or that you've never met before, but your mentor may think might be a good person for you. There are also mentorship, I think, programs that are done within ASCO where fellows, I think, are going to be paired with medical students to actually help them navigate the conference, because they do recognize that this conference is a behemoth and it's really hard for medical students to navigate. So that's an option as well. And also reaching out to trainees, so residents who are going currently, if you know of any, asking them to sort of be your guide and help you kind of navigate conferences. I know I've done it for medical students who I've worked with, and even ones that I just know, I realize how scary it is to go to ASCO. But I think that is a great way to kind of break the ice and get into these spaces where you can talk to individuals. And then the one last thing I'll say is don't feel too pressured to do small talk. I think it's very uncomfortable for anyone to do. I think it's easier to not have a cold conversation with someone you don't know. Or it's less easy to do that. It's probably much easier to be connected by someone that you know, even if it's a person of a person. So I think that the best way to do it, my advice would be to see if you can have your mentor meet with you, help you connect to people, or suggest people you can connect with, and also look towards people in training, like fellows and residents, who may also be able to help you.
Well, thank you so much. We are bumping up against our time. I know that there's another question in the chat. I don't know if Dr. Santos, if you'd be willing to share your contact information afterwards, we can always follow up with that.
Yeah, no, I'm happy to.
Okay, great.
For my email.
So I want to say thank you again, Dr. Santos, for taking the time to speak with us, and thank you to the team at MSKCC for arranging this and facilitating. This has been incredible. We will be following up with the recording for the presentation, as well as information from Memorial Sloan Kettering about additional opportunities for medical students. So stay tuned and keep an eye out for those. Again, thank you all for joining, and I hope you have a wonderful evening.
Thank you all.
Bye.